Good morning and welcome to Conversations on Showing Up for Kids. It's part of the Children's Resource Center South way that we try to interact with parents, the world around us to help support those families who have children with special health care needs and disabilities. I'm director of the Children's Resource Center South and host for Conversations on Showing Up for Kids. Today, we are also being joined by my dog. So that's Cammie. Cammie, anytime that I start talking, or in a Zoom meeting, decides that she needs to come in and get pets. So that is what I am doing as Cammie is in here. Today, we have not only a great topic, we have someone that I've known for a while and that I enjoy, but it's also a topic that's near and dear to my heart as having a 25-year-old on the autism spectrum who struggles with depression, anxiety, and some other mental health struggles. So today, we welcome Lindsay McCary. She is Director of Psychological Services at KGH Autism Services and does more than that, does much more than that. But Lindsay, thank you so much for being here today.
Yeah, I'm excited. Thank you for having me again.
All right. So, hey, let's see if we could just start off with a little, I guess, what people call level setting. And please, along the way, feel free to put any questions you might have into the chat. In about 15-20 minutes, we'll open it up for other questions as well. If you feel like unmuting and questioning, you do not have to take your camera off. We totally understand that not everybody is ready to be seen. But we see you and we're glad you're here. So, Lindsay, let's talk first about what are we talking about when we're talking about depression?
So depression is a mood disorder, meaning that there are symptoms of sadness, a loss of interest in something that people enjoy that lasts for a prolonged period of time, so at least a period of 2 weeks at a time, and that cause difficulty in functioning in day-to-day activities. I think another thing that's important to recognize with depression is it's a cyclical condition, meaning people who have depression aren't necessarily in that depressive state all the time. There may be times where they come out of this depression, but then they might go back into it. So we have to understand that there can be this pattern of good times and harder times that go along with a depressive episode or having depression.
Yeah, one of the ways that I had someone describe it to me once is it's not like I'm never happy, but if given a choice, my default seems to be sadness and seems to be depression. It just seems that that's where they set back to instead of setting back to contentment.
I think that's really important. And we think about that as like an intentional bias, where when we're getting messages throughout the day, people who are depressed or have depression often are paying more attention to those negative messages or the things that aren't going well. And then they tend to ruminate or think about those messages over and over and over again. So instead of focusing on the positive things or the good things, they tend to focus on the things that aren't going well. And then that can be a cycle in and of itself of I'm always thinking about these negative things that's decreasing my mood. But absolutely, people who are depressed can have those times of excitement and happiness and joy. They just might be fewer and further between.
And I've also begun to think about depression as more than just a reaction to events around me. Is I've come to understand with who I am that there may be a chemical thing going on in my head. There may be a way that my brain itself is not dealing with thoughts too well, or disconnect between my thoughts and my feelings and what's going on with my body and with events and people that are around me. And that's a lot to think about as we think about depression. Is it's not just this one thing is happening, so therefore I am depressed. It's like this circle, this surrounding effect of all sorts of stuff in life.
Absolutely. And I think going back to that chemical imbalance is really important because we know that's really a lot of what's causing those depressive symptoms, or at least increasing risk for having depression. And so we talk about medications and other things that can help with that, but understanding that somebody might have higher risk factors for depression can help us think about like lifestyle changes or environmental changes that might offset the symptoms or even make them less severe when they do happen. And I think your point about context is super important. Like there's a lot happening when we think about somebody who has depression or other mental health conditions.
Well, and I think of that especially in relationship to the different neurology that our friends with autism or an intellectual or developmental disability, that their neurology may be a little different and not reacting the way that people would expect them to react to the world around them, which to me means that depression may look slightly different in someone with autism. Is that fair to say?
That is very fair to say. And we know that people with autism and other developmental disabilities are actually at higher risk for depression and mood disorders. So they're diagnosed, they have those symptoms more often, but often misdiagnosed because of the differences in how those symptoms present. So if I'm working with an individual who doesn't have this diagnosis, I'm relying on them to be able to tell me that I feel sad, or I'm not interested in things that I used to be interested in. I'm sleeping more, I'm sleeping less. And for many autistic individuals or people with developmental disability, they may not be able to say those things, or they may not even understand that in themselves. So there's a condition called alexithymia, which is this idea that some people may not be able to recognize different emotions or those bodily sensations that you're talking about, which then makes being able to report on these symptoms more challenging. So as a clinician, when working with this population, we have to understand, like, what are other symptoms that may indicate depression, not just relying on somebody telling us that that's how they're feeling.
Wow, that is so important, because you're right. Most of the time I think of, people saying, "Oh, are you depressed? Are you sad? You look down." And if someone is unable to identify what that means for them, they're not going to be able to respond appropriately. And they may just give us the casual "fine, I'm okay, leave me alone." But we can observe, and we can learn things from the way people change or don't change. What are some of those ways that if we have a person in our life who's not able to tell us what's going on inside, what should we be looking for if we're worried about depression?
Definitely those changes. So with depression, some things we might see change is somebody who is sleeping more or sleeping less than their baseline. So we know people with autism and developmental disabilities have a lot of sleep challenges, but it would be thinking about a change in what their normal is. It could be a change in eating habits, appetite, again, either eating more or eating less. Or if you notice that somebody isn't engaged in the things that they used to enjoy. So if we think about people with autism who might have really strong interest in a particular area, and maybe you no longer see them wanting to go to do that activity or talk about that interest, that would be something I'd pay attention to. And especially in children, sometimes we see increased irritability as a symptom of depression. So we might hear teachers talk about like behavioral challenges, but if that's a change, I would want to know what else might be going on in terms of that person's mental health and mental well-being. And is that irritability really a sign of depression? So those are things that I'd be paying attention to and would be asking questions about.
Yeah, I think it's true that we don't all of a sudden just develop new behaviors.
Right.
There's causes for them, and sometimes we have to take the time to not just write it off as a one-off, but to look at it and ask what's going on.
And looking at those patterns across settings. So any of those changes, I would expect, if it's indicative of depression, we're seeing those things at school, we're seeing them at home, we're seeing them in the community, even though they might present slightly different in those settings. But again, that pattern of change for that individual.
Oh, and it also strikes me that even before we start thinking depression, if all parents, as a parent, I say that we need to become those investigators, and we need to understand those patterns and the cycles and the pressure points of our children, so that we can notice when those changes are. I just think that's really important from a parent point of view.
Yeah, I would agree with that. And as on the clinician side, I want to hear that from the family. I want to know, what is your child's baseline, so that we could be making a good assessment from that information, rather than comparing your child to other children or another group of individuals, because depression can be so individualized in how it can present.
So we have a comment in the chat. Someone has come in and said, our son shows depression or pain by increased OCD fixation,
Yeah.
compulsive disorder, or more meltdowns. His sensory sensitivity increases, which causes a lot of things become more difficult, causing more meltdowns. He usually needs a lot of time alone to rest. Depression can be very tiring.
Yes.
We actually homeschool now because of how difficult it was for him in a school environment when feeling pain or expressing depression. I can very much relate to that as a parent. Thank you so much for sharing that.
Those are great examples of what that might look like for an individual. Yeah.
So let's say a family has, thought about their child and they're looking at them, they're seeing this change in behavior, this change in sleep habits and eating habits of, I'll give you one example of a change in interest. Is there was a few years back, my son Hunter was going to online Dungeons and Dragons on Monday night and Thursday nights, and then on Saturday. And when it was in person, he would go there on Saturday nights. And then it seemed he only was doing Saturday. And I'm like, dude, what's going on? Because I know he loves Dungeons and Dragons. He's like, well, Dad, I'm now Dungeon Master. I'm DMing for the Saturday group, and that takes a lot more time and energy. So I'll get back involved when I feel like getting back involved. But it's those changes that I think parents can be aware of. So let's say we have parents aware of that. What can they do?
Yeah, I think certainly talking with their child's doctor, or if they already have a therapist, is a good place to start, or even teachers, other professionals at school, just to get some guidance of, are there interventions available immediately? And sometimes that can happen like at school, with meeting with the school counselor or school psychologist, or getting resources to support them. And then that can also help with accessing mental health services. So I think sometimes there's a perception that traditional mental health services like cognitive behavioral therapy don't work with people with autism or intellectual disabilities. And we actually know that they do work. There might be ways we modify those services, but we do want autistic individuals and individuals with intellectual and developmental disabilities to access mental health therapies when we're concerned about depression. We also know that accessing that can be challenging for a lot of reasons. There are long wait lists, insurance barriers, and then we face providers who say, well, I don't know how to do this with autism or IDD. So I think things that families can do in the meantime is supporting those interests that their children have, kind of reintroducing some of those interests and joining in those interests. So forming some of that social connection we know is really valuable. Again, balancing, like you said, Tim, those times where your child might just need some space, want to be alone, but really trying to form connection as much as possible. And then also helping your children maintain or develop those healthy habits. So exercise is actually a really effective intervention for depression and anxiety. And exercise doesn't have to mean 30 minutes a day of rigorous activity. It can be like walking to the mailbox and back, or walking around the block, or walking up the stairs, just to increase some of that physical activity. And paying attention to what your child's eating as much as possible. Again, another area of challenge sometimes, but how can we help with some of that healthy food choice? So those are some like immediate steps to help with depression or some of those symptoms, but we can also think about things like labeling our own emotions when we're experiencing them. So I had a really tough day today. I'm feeling really frustrated. My body feels tense. My face feels hot. To help teach our children to identify those things in themselves, providing some of that modeling and language can help with that as well.
And I especially think that healthy modeling, then, this is what I'm going to do to help myself. That it's
Right.
okay to take steps to help yourself feel better. That you, even if you feel stuck, you could take that walk. You can take action to help yourself feel better. That's okay. That's what you need to do. It's not always going to just pass with a good night's sleep. Sometimes
Right.
it does. Sometimes the best thing that I
Mm.
could do is go to bed and to take a nap. It's amazing to me how much better mentally I feel and emotionally when I am well rested. But there's other things during the day that you were talking about that I can do to help myself feel better.
Absolutely. And sometimes we just need that reminder or that prompt or somebody to tell us. I mean, I'm a psychologist, yet when I'm having a bad day, I still benefit from my husband saying, like, have you ridden your bike today? Because for me, that's what works. And so we can think about the same principle of our kids who may not have those tools and resources. And so, how can we model those and teach those and help them engage in some of those activities that are a good first step while waiting for more intensive interventions?
And I appreciate that you acknowledge the fact that sometimes it's hard to find psychologists or therapists at all as we're dealing with an overall shortage. But then to find someone who understands that uniqueness of someone who is neurodivergent, has a different neurology, that the therapies themselves could work, but the approach needs to change a little bit. And I'm thinking a couple things in my mind is that whole some of our kiddos have longer processing times. And so being able to sit there and wait for an answer and not push for an answer could be really important. Helping to make ideas, concepts more concrete and interact with where their real world life is and not being so abstract with some of our examples. Are there other ways that you can think of that could help
Yeah,
counselors or therapists to identify with our kids?
absolutely. I think those two are absolutely things that we would recommend, and being more flexible in what that communication looks like. So, for some individuals, using their communication device or being able to write or draw instead of traditional talk therapy, those strategies can be helpful. And I think overall, like slowing the pace of therapy. So, in the session, right, giving time for response for responding, but also maybe therapy takes longer. Maybe instead of 16 weeks, it takes 32 weeks because we just need more time to make the same level of progress. And then I think those sensory pieces are super important. And how are we thinking about the sensory component within a therapy session? So some therapist's office, they might have different scents that are supposed to be relaxing, or different kinds of lighting or sounds that for somebody with sensory sensitivities may be overwhelming. So taking those pieces into account so that the space can be conducive to therapy is really important. And then the last thing that I think is really impactful is even starting therapy with teaching about emotion recognition. So instead of jumping to, okay, you're feeling this emotion, now how can you change your behavior? For many of our clients, it's even understanding, well, what does sad feel like? What does that look like in my body? And just starting with that is really important to then build those skills.
I cannot emphasize that enough. As having a child who's neurodivergent, and another who has special needs, and then myself who has my own things, that identifying can be really hard. Because sadness can look like depression. A little bit of anger could make me sad, and so learning the nuances almost of emotions can be really hard and can take time. But our kids, one of the things that I'm learning with my son is they continue to grow and learn, just like I continue to grow and learn. It's not like at 18, their brain stops. Our
Right.
brains continue to be able to learn. Our bodies, our minds, our spirits continue to be able to learn. And so if we patiently continue to explore that learning, they're going to be able to learn.
I have an example, just it's kind of a compilation of a couple different clients that we've worked with, but where you might ask somebody, how are you feeling? Are you feeling depressed? And perhaps the response is, no, I feel fine. But then later in the session, there might be comments of, I don't understand. I'm sleeping all the time. And when I wake up, I still feel tired. Or, I just don't want to go to school anymore. I'm not interested in that. So the person may not understand what these emotions are, but they're giving really good behavioral descriptors. And then the therapy would help them understand what that depression is like, to then be able to rate it. So then we can make progress in how do we deal with that? What are those strategies to use?
Yeah, I love that. And I'll share one strategy that my son has taught me that he likes to talk about when he talks about autism and anxiety is he says, one of my therapists taught me to just stop and stare at a spot on the wall for like 5 seconds, and it just resets where I'm at. And he said, when that doesn't work, then I go into the walk-in cooler and I scream. And then that usually works. And I love both of those examples. It's like, just if you're feeling overwhelmed, stop. Just stop, do a reset, focus on something else, and then you can come back. And sometimes screaming in a frozen locker helps as well.
Sometimes it does. And I love that he has that hierarchy of first, I'm going to try this. And then if that doesn't work, I have a backup plan. Yeah, that's awesome.
So, well, thank you. I do want to invite other people into the conversation. Please feel free to, I can see, so you can feel free to unmute if you would like to use your voice to communicate, or if you don't choose to use your voice, you can put stuff in the chat and I will be able to then verbalize it and communicate it. So please feel free to any questions that you might have. But Lindsay, the last sort of question that I always like to ask is what didn't I ask? What have I missed?
Gosh, that's a great question. I think to me, one of the big things that I like to educate on is just that recognition. So again, we have a lot of professionals out there who say, oh, I don't feel comfortable with autism, but we have 1 in 36 individuals who have autism, right? So as a field of mental health professionals, we need to get comfortable with autism. And I think understanding what depression can look like and how it might present differently is just really helpful for families, teachers, those professionals, so that we can best provide intervention and treatment. Again, recognizing behaviors and change and using those indicators to ask the questions of, hey, what else might be going on here?
I love that. That's a great final comment, is watch for change, watch for those behaviors. Everybody has a different baseline. And generally, when we're not operating close to our baseline, there may be something that we need to work on, that we need to question, that we may be in a little bit of pain somewhere.
Absolutely.
Okay, I am not seeing any questions coming up in the chat. No one's unmuting. Oh, wait. We do have something in the chat, and it involves something that I can't pronounce.
Alexithymia.
Thank you. Could you answer that for us, please?
Sure. So, yeah, the question is, what about cases of alexithymia in the parent or child? So alexithymia is just this idea of an individual not being able to recognize their emotions and therefore report on their emotions. So if I'm feeling sad or irritable, I may not know that or be able to describe that. So I think for children or the person who's participating in therapy, providing that education on emotional identification and emotional awareness is the first step of therapy, to be able to help somebody overcome some of that alexithymia, where they're better able to say, well, when my body does this, that means I'm sad. That means I'm angry. There's a concept of interoception, which is this idea of a sixth sense that's recognizing one's own body sensations. And sometimes we see that people with autism or developmental disabilities have a harder time with that. So we might focus on those body-brain exercises so that you can make those connections, which helps with emotional identification. I think in the case of parents, also experiencing this lack of emotion identification or recognition, then we'd want to invite them to be part of the therapy session, so that they're learning the same things that their child is learning, so they can reinforce those concepts at home, and that everybody's on the same page in terms of how we're moving forward.
And because we have done so well today, we're going to go into a little added bonus content now that somebody brought up parents, is the importance as a parent of a couple children with special health care needs. How I handle my own mental health is really important. Is this whole idea of the more stable, regulated, the less out of control I am, then the better the family is going to be regulated, the environment is going to be regulated, and there's a lot of pressure and there's a lot of stress involved in raising a child with special health care needs. And it's not as easy as, oh, go take a bubble bath and light a candle.
Right.
That could work. But sometimes it involves us looking at our own behaviors and what does it look like when we are operating from a healthy point of parenting? What's going on in my life when I feel healthy and I feel energized and I feel like I could be there for my kid? Is it that regular exercise? Is it getting sleep? Is it asking for help? Is it the food that I eat? And really taking a little bit of time to work on our own emotional regulation to be able to help our kids to emotionally regulate.
Absolutely. I 100% agree with that. And I think your point too of recognizing that we have to do that to be good parents for our kids. Absolutely.
All right, I'm going to start to close this out again and see if we have a last thing that sneaks in, which is fine. If you have a thought, please complete it. Get it into the chat. That's why we're here. But barring anything else coming up, Lindsay, thank you so very much. What everybody doesn't know is that this is probably the 4th different date and time that I asked Lindsay to be part of conversations. And so
I always love to be here.
I appreciate your flexibility and your reminders. And I enjoy having these conversations. Mental health, it really does matter. And so it's okay to look at it from the point of view of our children.
Well, thank you for having me.
Have a great rest of your afternoon. Thank you, everyone.
Thank you.